Welcome, everyone. Dr. Mercola helping you take control of your health. Today, we're going to talk about your eyes. It's a topic I really haven't delved into very much previously, other than preventing the most common cause of blindness, I think, in the world, if not the United States. Perhaps Taylor can correct us if I'm mistaken. But that's age-related macular degeneration, or ARMD. Maybe it's AMD now. I don't know. They changed the terminology, but that's due, I believe, pretty strongly. Perhaps we'll talk about this too. Is to linoleic acid, and then causing the oxidative stress, and just it didn't exist. It didn't exist before 1900. There's no record of it, so it's clearly an artifact of industrialization of the food processing system. So anyway. The reason we're going to talk about eyes is because our guest is Taylor Lorenz, and she's an optometrist, a recent grad. And you might wonder, why am I interviewing someone so young and new to the field? Well, I've been very impressed with the interviews I've heard of Taylor in the past, and she's embraced the bioenergetic model for optimizing health. And I thought it would be really intriguing to have a conversation with someone who understood that model, is also a professional trained in eye health, because there's so many tweaks that you can do that can optimize it and preserve it and keep it healthy. And it probably is our most valuable sense. If you could only if you didn't want to get rid of any one single one, it'd probably be your eyes, I would guess. So with all that introduction, thank you, welcome, and thank you for joining us.
Yeah, thanks so much for having me. It's such a pleasure to be here.
All right. So you're I don't think I've ever interviewed someone in outside settings. That's very delightful.
It's finally nice here, so I got to take advantage of it.
Yes, indeed. Yeah, but it's nice that a lot of people I interview, and they're always in their home, just like me. I'm not outside. So that's really good that you've been able to do that. Mm-hmm. So why don't you tell us a little bit about your history, and I'm specifically interested in how you started up understanding natural medicine and how it was going through professional optometry school with that understanding, because I'm sure it violates a lot of the principles that you're embracing.
Mm-hmm. Yeah, so in optometry school, I was before I went to optometry school, I started to definitely get interested in natural health. But as I was in optometry school, I started to learn more about things like root cause medicine and functional medicine. And that really piqued my interest because, of course, I already knew about how important nutrition is, especially for eye health. There's specific conditions like macular degeneration that are entirely dependent upon your health and what you're eating, especially not consuming seed oils and things that are high in polyunsaturated fatty acids. And so, when I was in optometry school, I realized there was definitely a gap where people who have these, chronic degenerative conditions are not getting, the proper education on how much lifestyle, diet, and all those factors really play a role in your eye health. And so it was a little bit frustrating for me at times when, there's you have 30 minutes in an exam room with a patient, you're kind of rushed, and there's really no way to go into all of it. And it's really, the system is just set up in a way where you can't really address certain things that could really benefit, people that have chronic diseases. Especially a lot of people are told, there's nothing you can do, there's nothing you did to deserve this. It's just luck. Terminology like that can really make people discouraged and feel like, there's nothing they can do to improve their eye health, when really you can improve your eye health at any age. I really just wanted a way to be able to give people an alternative route, a different way to kind of see eye health and improve their vision at any age. And the best way for me to really do that was to go into health coaching more and be kind of an advocate for how you can really just improve your eyesight at any age. You don't have to, always rely on the traditional medical system, even though I think with certain conditions, an integrative approach is definitely the best way to go. There's so many more things out there that people just don't know about. So that's kind of what inspired me to get into more of the bioenergetic side of things.
So, well, thank you for that background. And you're somewhat of a rebel because I suspect the impression of almost everyone's view of an optometrist is it's really almost a mechanism to sell eyeglasses because it's the primary reason why people see most of the optometrists. But that is probably not even part of your repertoire because you don't even have a regular office. You shifted to a health coaching model.
Yeah, I'm definitely the way I work with clients is different from the traditional system. So I do bioenergetic testing, which is based off hair and saliva, and that tells me nutrient deficiencies, mineral imbalances. It'll even tell me like specific toxins that are impacting the eyes. So I'll see things like mold, parasites, bacteria pop up. I see like Epstein-Barr virus affect the eyes a lot. As well as just viral toxins in general. You can see histamine issues and things like that. So it really just helps me to pinpoint, what parts of the eye are stressed. And then I also connect that to the full body health by seeing like which organ systems are most stressed. And then we can even see like what supplements are resonating with people's bodies. That gives you extra clues into, what parts of the body are stressed and how to best support them that way.
So when you say supplements resonate with the body, is that like with something like muscle testing or?
It's similar to that. So with the bioenergetic testing system, you can pretty much customize it. So let's say a certain supplement like homeopathics, I test a lot using homeopathics. I do a lot of like cell core. So basically we can test their hair and saliva to see if they're resonating with certain supplements and certain remedies.
Okay. So is there a specific it sounds like you're using an instrument then to do this bioenergetic testing.
Yeah.
Right?
So it's done on a Quest 4. The machine I use is Quest 4 bioresonance machine.
Okay.
And it's basically like a database. Everything that, in the world holds frequency. So basically how the body is responding to the frequencies that it's exposed to will tell you what's out of balance and what will bring the body back into balance.
Okay, is this an instrument that you have to be there in person with you, or is this something that can be done?
So it can be done remotely just based off the client sends in their hair and saliva.
Okay. Oh, so it's not a traditional hair and saliva test. It's tissue analysis, but through this bioenergetic testing instrument that you have.
Exactly.
Okay, because when you say hair and saliva, I'm thinking you're sending it into a lab like Dutch testing or these other objective, lab instruments that give you specific quantitative assessments of what's going on. But this is more of an energetic assessment.
Yes.
So that's really interesting, Taylor. So I'm wondering if you could help us understand some of the most common ailments of the eye that people come to seek help with when they see you.
Yeah. So I work with, a lot of people who basically the eyes have a really high oxygen need and they have a really high metabolic rate. So they're one of the first places that we see in the body that starts to degenerate. So I see a lot of people, anyone that has like neurodegeneration and is their brain is under a lot of stress, their eyes are going to reflect that. So yeah, I see a lot of people that are struggling with glaucoma, macular degeneration, people that are just like having like declining eyesight and they don't know why. So people that have myopia, a lot of these people are doing a lot of near work. They're working on a lot of screens all day. And then also there's conditions like things like strabismus, and that depending on when it develops, can kind of clue you into the cause of it. So things like heavy metals can even, cause things like strabismus. And so it can also happen due to like, let's say the mom is put on bed rest and the child isn't getting the movement in utero that they really are supposed to be getting. That can also lay the patterns for a child to have strabismus later on. So kind of what I like to do is kind of uncover like, is this a nutritional problem? Is this mainly like a nervous system problem? And kind of just figure out how to best treat the person overall. Specifically with glaucoma, I see a lot of people that are affected by mold. They have things like root canals and a lot of dental work, um, exposure to radiation, especially a lot of EMF exposure can also really tax the eyes. I've also been seeing a lot of people come to me lately with cataracts and even like early onset cataracts. So
Mm.
typically we think of cataracts as like an old person thing, but I'm seeing people in like their 30s and 40s getting cataracts kind of really prematurely. So again, that's 100% environmental toxins, things like that that are and nutrient deficiencies and just a lower antioxidant status in the body because the main antioxidants in the eye are melatonin, things like glutathione, and especially vitamin C. There's actually, I think, there's like 40% higher vitamin C need the eye that the eyes have compared to the rest of the body, and the eye actually has so much more vitamin C because of its high metabolic rate. It needs a lot more antioxidants. So
Great.
that's one of the
So my guess is that when you're addressing these fundamental causes of disease, you're not only resolving the eye concern, but most likely improving the rest of the body and improving their longevity because you're
yeah.
hitting things that are damaging. The eye just happens to be a particularly susceptible target organ to this damage and gives you an
Mhm.
early warning signal, so to speak.
Yeah. And the eyes are also like especially susceptible to polyunsaturated fats.
Mm-hmm.
And we see this in certain eye conditions. For example, there's a condition called like Biede's crystalline dystrophy. I actually just worked with someone who has this, and it's basically like a PUFA poisoning disorder.
Mm.
And so what happens is there's like crystalline deposits that build up in the retina. And this is due to the body's inability, based off a specific gene mutation, an inability to metabolize PUFAs specifically. So it's interesting that it builds up in the eye, but even though this condition affects other organs like the liver, the heart, the lungs. We don't see the buildup of the deposits in those other places. And the reason why is because we have like other innate mechanisms in these other organs that we don't have in the eye that kind of work as like a backup mechanism to prevent degeneration there. So, yeah, the eyes are just super susceptible to. Nutritional deficiencies and environmental toxicities and everything like that because they have such a high metabolic rate.
Now, in the only other health professional I've interviewed in the past was Chris Snowby, who's an ophthalmologist, and he actually wrote a textbook. It really is a textbook. It's not for a layperson about the historical progression of age-related macular degeneration. He actually has a foundation for this too, and it's his conclusion that the seed oils or high doses of omega-6, specifically linoleic acid, were the primary culprit. And I'm wondering if that's been your experience and if what your view on it is.
Yeah, I definitely agree with that. I really think that this is something that builds up over time in the eye. So it's really something that you have to start young. That's like the biggest thing I would say because even at like the age of 18, we start to see these lipids build up in the eye.
Well, you
So
can physically see it with
you can
your
actually
equipment, like a
see it.
slit lamp microscope, or
Yeah, so if you dilate the eyes, and then you use like a lens in front of the eye in this, and you can basically see into the retina. So the eye is the only part of the body that you can see into without cutting open. So we
hmm.
can see the blood vessels, we can see um, the optic nerve, which is basically where most of the retinal ganglion cells are. So we can actually see degeneration of retinal ganglion cells looking at the optic nerve. So, one of the earliest ways that we can see degeneration in the eye is using a visual field test because we'll see, um, kind of parts of the visual field that are missing, or little spots in the visual field that are missing, before we actually see degeneration in the eye, in the optic nerve. So that's actually a really good early detection for glaucoma, because we'll see the visual field defect before we see changes on the optic nerve. So that's one of the most sensitive tests we can do to catch things early. Even things like Alzheimer's are being caught early using the eyes. And it's really cool how much you can actually see. Yeah, so it's interesting that, we can look for, so with macular degeneration specifically, you see like these spots that they call drusen, which is kind of a buildup of calcium, lipids, and things like that. So basically you can actually see those, but they're very tiny. So you have to like look very carefully in younger people. So it's kind of interesting how early these things actually start.
So have you had, well, let me, before I ask the question, the half-life of seed oils is close to 2 years. To get them out of your body, it might take 5 years or so to significantly reduce them. And I'm wondering if you've seen any improvements implementing these therapies specifically with strategies to reduce seed oils and seeing changes clinically, or it's difficult to answer that because you're doing so many other adjunctive strategies in addition just to eliminating the PUFAs.
It's difficult to say. I definitely think things like macular degeneration, since it has been like accumulating for so long over a person's lifespan, I would say definitely slowing and stopping progression is the main goal. Because we don't want this to, like, early macular degeneration, people usually don't have, visual field problems or problems with their sight. It's really once it goes from the dry stage to the wet stage. And the wet stage means that there's like fluid leaking out, and things like that. And there can possibly be blood in the retina as well. So the later stages is when we really see, the visual complications from it. But even if you catch it like in the dry stage, you can still prevent progression, of course, by, doing the right things, eating the right things, cutting out the seed oils, improving nutrient status. So especially zinc is super important. Zinc is actually what helps retinol go from the liver to the eyes. And we know retinol is super important for vision and your photoreceptors and eye health. So yeah, I would say you can definitely slow and stop progression, even if you do catch things once, you have the diagnosis. So yeah, that's the main thing. Even with cataracts, I think there is a way you can reverse mild to moderate cataracts, but once it gets to the severe stage, obviously it's a lot harder to reverse that damage.
What might those ways be?
Yeah. So with cataracts, it's interesting. I think there's NAC eye drops. People have had success with those.
That's interesting. Let's stop there for a moment because, I was intrigued with that. And when you do a PubMed search on it, you'll find studies that suggest that, but then other studies that attempted to reproduce those results and didn't, sort of just debunk that approach. And I think it was my impression that the consensus was it didn't work. It's N-acetylcysteine.
I think
no, it's not N-acetylcysteine.
Yeah, N-acetylcysteine. I think key.
But it's N-acetylcarnosine.
Carnosine, yeah.
It's carnosine, not cysteine.
Yeah. So the thing with it, I think the main problem is that it's hard for the molecule to get where it needs to go. So I think what you really need to do is you need to put it with a carrier. So something like DMSO is a really, really good carrier molecule. And then the other one that I've recently been researching a lot, it's called emu oil. And emu oil can actually penetrate like all 7 layers of the skin. And it's a really, really good carrier oil. And it's also super high in vitamin K, which can also help in reversing cataracts.
Okay, so this is very interesting. So it's seen where I'm assuming this administration of the NAC to the eyes topically, so for some type of eye drop, right? So that's where it seems to be confusing because an emu oil is a lipid, and obviously oil and water doesn't mix. So how do you integrate unless you emulsify it of some sort? Do you emulsify the emu oil into the solution?
I've just been telling people to mix them.
Yeah, but it shouldn't mix. What it's water and oil. How does it mix?
I've just found that, people have been having like better results when they use the carrier oil. But I
Really
guess you're
interesting.
right, like it shouldn't really work as well. But then the other thing I found that can
Or
help,
DMSO. Do you use? Have you?
you can use DMSO as well.
What concentration of DMSO?
There's this one, I think it's 20%. There's a 20% and a 40%.
Wow,
And they formulate DMSO eye drops, I
they
found.
do.
Yeah.
So you can get that. Is it a prescription or
It's not a prescription, no. I
just
can.
DMSO eye drops, and then you just
Mhm,
throw some N-acetylcysteine or
mhm.
carnosine in it.
And then you can also use the emu oil as well as a carrier.
Do you
The other
have you used them both?
I've used them, yes.
I mean,
I'm
together in the same eye preparation.
You can combine them.
Wow, interesting.
So then the other thing I found that's really interesting. I found a study that they're trying to make aspirin nanorods, and that's like a repeat thing. Repeat says aspirin is like really good for reversing cataracts. Um,
Really? Is it? And this would
mhm.
be topically through the eye?
So they're actually trying to develop aspirin nanorods as a
What's that?
treatment.
An aspirin nanorod.
Nanorods. So I found this study like out of India.
Uh-huh.
And of course, like they would never try to make this in the US because cataract surgery is like such a big
It's
money
the number
maker.
one surgery in the
It's
country.
number
Number
one
one.
surgery. Yeah, exactly. And so it's really interesting. I was reading about the aspirin nanorods. So I think the problem with the eye drops is that they're not small enough to penetrate. So what you have to do is you have to, I guess, do something in a lab to make them nano so that they can get into the eye. Um,
Oh.
and then the other eye drops that people
Oh, wait,
use,
wait, don't say it. So, have you found a source for these aspirin nanorods?
I wish.
Yeah.
I was looking, I was looking into it and I was like, oh man, like I don't have a lab to like make, these nano aspirin drops, but I'm so interested. I'm like, I guess I maybe need to go to India.
Wow, that is
That's where
interesting.
they're
Well,
developing
it's
this.
just interesting. The first step is understanding that the possibility exists, and this, which is actually probably the hardest part of the equation. And the second step is just implementing it and innovating to get it created. So that's a big pearl. Thanks.
Yeah. Um, Interestingly enough, like emotionally, cataracts can be related to the failure to share knowledge. So I always find like the emotional aspect so interesting, especially like with myopes. Myopes have like specific personality traits. So they're typically like type A
And
personalities.
myope would be a nearsighted person.
Nearsighted, yeah. So you can't see far away.
Right.
So typically like type A personalities, overachievers, they can be really like self-critical, kind of like retreating into themselves a little bit. Um, Also, I find that like people often become myopic after like a traumatic situation, like parents' divorce, for example. So yeah, it's super interesting that connection. But back to the eye drop thing. The other eye drops that I found are like a nanofulvic acid eye drop. People have
Really?
had success with those for dry eye.
Okay, but
And a
not for
lot of,
like not for cataracts.
I mean, theoretically, I think they can also help with cataracts. I do like and then I've also found taurine eye drops for glaucoma. Those
Oh,
can
that
be
I was
really
definitely going to get you
beneficial.
glaucoma. And what's the concentration of the taurine?
I'm
Like
not sure the
2%?
concentration of those. I'm not sure. I have to check. I think the eye drop that I found, it's called Taustin.
Hmm. How do you spell
Um,
that? Taustin?
Taustin.
Stin. Okay.
Taustin. That might not be right. Wait. Let me double check. Yeah, Taustin eye drops. Okay, it's 4%
4%.
concentration.
Okay.
Yeah.
So in 10 cc's or be 400 milligrams.
And so yeah, that one specifically been really interested. I actually do see that resonate with a lot of people. So people are definitely resonating with that one on bioresonance. Um, so yeah, that one's been
So
really
it's
interesting.
checking out energetically. It seems to be good.
Energetically, it seems to be resonating with people.
And this is for glaucoma. And if you've seen, I would assume that the improvements would be relatively rapid. Have you seen any? I mean, do you when they come to see you there personally? Because you can't check their
Yeah, I
measurement
can't check. But I
virtually.
mean, they do obviously co-manage with their eye doctor. And
Okay.
so they are getting their eye pressures tested. The other thing I recommend for people with glaucoma is making sure you don't have any sleep disordered breathing, because that is honestly one of the main causes for like the nerve degenerating, because when you sleep, they find the eye pressure can go up from 6 to 10. So when the
Mm.
eye pressure goes up, that's when you have damage to the optic nerve.
And
So,
for those of us that aren't familiar with the measuring system, what is a healthy measure pressure in the eye and an unhealthy pressure?
so with eye pressure, ideally it would be around 15 to 20.
Mhm.
I would say that probably the average eye pressure is around 15.
Mhm.
Um, so anywhere from 15 to 20, they say you're okay, but you start to get into like ocular hypertension once it hits 22. So
Okay.
you really do want it to be around 15.
Okay.
Um, yeah, 10 to
And
15.
so you're saying if you have the sleep breathing abnormalities, it can go up 6 or 10 points.
So people that have glaucoma, a lot of them have sleep disordered breathing where they're having these apneas at night. Um, they might be mouth breathers, and when you're a mouth breather, you're not getting as much oxygen and blood flow to the optic nerve. So that's a really, really key point. And I think a lot of people that have glaucoma aren't told about this. The one that it's more connected to, the sleep apnea, it's more connected to normal tension glaucoma. So they find that people that have glaucoma, yet they don't have the high eye pressure, that can be due to sleep disordered breathing because the eye is not getting enough perfusion.
Mhm.
So that's not really as much a pressure issue, it's more of a perfusion issue.
Interesting.
But I think anyone that has glaucoma really needs to pay attention to that, because even if you don't have like full on sleep apnea, you can still have like partial mouth breathing throughout the night, and just like maybe a couple of apneas throughout the night, but it's not like the whole night. So it's not like being picked up.
Interesting.
And then that also relates to choline in the eye, because when you have sleep apnea, you're also having issues with choline a lot of the times, and you're low in choline. So that's one of
As
the
a cause of the sleep apnea, not as a cause of glaucoma.
so it kind of goes hand in hand, because when you have sleep apnea, that often goes hand in hand with not having enough melatonin, and melatonin interacts with choline.
Wait.
So
This is an odd connection. It's running circles in my brain to try to comprehend this. Why would melatonin be connected to sleep apnea? I'm sure I'm not disputing it. It's just trying to understand because normally things make sense.
so melatonin actually plays a role in oral development. So they find that people that are low in melatonin are more likely to be mouth breathers.
Oh, so this is a chronically low melatonin levels, or is it more of an acute scenario?
So it's chronic.
Okay.
So if someone has, mold toxicity, a lot of times they do have low melatonin. Also, if you're low in the precursors to melatonin, so um, specifically low serotonin, you have low tryptophan, those are kind of like the precursors to melatonin. Also, if you're low in B6, B2, those also are kind of needed to create melatonin. So if you're low in zinc as well, that can also lead to melatonin deficiency. So a lot of these nutrients are actually affecting sleep as well. So that's why the melatonin being low also affects choline as well.
Okay, interesting. So would you address the choline deficiency? I would imagine that would not be topically in the eye. That would be something you'd happen to meet more of, like phosphatidylcholine or eggs.
Yeah, so
Yeah, egg yolks specifically.
I really like royal jelly for choline. It's the
Mhm.
only source that has like acetylcholine. So basically, if you're ingesting royal jelly, you wouldn't need the precursors because it's already in the usable form, acetylcholine.
Mm, very nice, very nice. Now, I'm
Yeah.
wondering, with the suggestion that serotonin deficiency would contribute to melatonin deficiency, and you being a student of Ray Peat's work, it's and I'm a recent advocate of his work, so my understanding is somewhat limited, but what appears to be a challenge to reconcile is that, from Ray's understanding, high serotonin is not a good thing. It actually is highly counterproductive. It's an anti-metabolite, it suppresses energy production in the mitochondria. So that's not something you want. So at least that, from his perspective, bioenergetic model. So you want to limit tryptophan and serotonin production. So how do you reconcile having enough of that when it's such an important contributor to melatonin? I mean, you can't make melatonin without serotonin.
I think it really depends on the person. So some people are low in serotonin. It also depends on your genetics. So some people, I definitely agree with Ray that some people can have high serotonin, and that typically goes along with high histamine. So people that have like high histamine are typically the high serotonin people. People that don't struggle with histamine are typically the low serotonin people. So personally, I'm one of those people that's low in tryptophan. I'm more prone to being low in serotonin. So yeah, I think Ray Pete's definitely onto something with that. But I also think there's so much bioindividuality that it really does depend on the person.
Okay, good.
But yeah, so the thing with melatonin is it has a role as an acetylcholine enhancer because it can block calcium-dependent release of acetylcholinesterase enzyme. So yeah, that's why intermittent hypoxia during sleep can produce lowered acetylcholine.
Now, you're probably familiar with Russell Reiter, who's, I think, incontrovertibly the most well-respected melatonin researcher in the world. He's published over 1,500 studies on it. And a few years ago, he helped us understand that 95% of the melatonin is produced from exposure to near-infrared light, typically from sunlight. So I'm wondering if you've integrated, well, I suspect you're aware of that because it's relatively recent, but 2 or 3 years, but you're really sharp and suspect you knew that. So I'm wondering if you've integrated that strategy into some of your therapeutic protocols.
Yeah, I've found that also going off of that, blue light also reduces melatonin in the lens. So this is like a big cause of cataracts. And then melatonin also can inhibit lipid peroxidation by improving iron overload. So melatonin can chelate iron because it has free radical scavenging activity. So yeah, definitely light is one of the key things for melatonin production. So basically,
so more red, near infrared, and
more red light. Yeah. So red light,
but certainly before sunrise and after sunset.
Yeah. So watching the sunrise, watching the sunset, red light therapy, all of that is going to help improve melatonin production.
That's great. So, and have you seen changes when you've integrated this into your protocols?
Yeah, a lot of people, well, someone that I'm actually working with right now is taking, so it depends on the person. Some people do better with topical melatonin, and some people do better with liposomal melatonin. And then I've also kind of been playing around.
And are these for eye disorder applications?
I haven't tried eye application. I don't know if that's been done or not, but it would be interesting.
Geez, if you're going to throw N-acetylcarnosine and taurine in there and DMSO and emu oil, why not throw some melatonin?
But melatonin, I found the suppositories, those can be pretty powerful. So yeah, the melatonin, my favorite routes of administration are topical, the liposomal, and then the suppositories as well.
And what type of dosages do you use therapeutically?
So I basically just go off like the serving size, but I also test people. So it will tell me like if someone's resonating with, let's say a Does Bio melatonin that I use, it will actually tell me like what dosage would work best for them. So I also go off of that.
Yeah, because some clinicians are using very high doses. Even Russell Reiter himself and this is based on the premise and observation, I guess, maybe more the premise and observation that there's virtually no toxicity to melatonin, somewhat like vitamin B12. So people are using hundreds of milligrams. I think Reiter himself uses 100 milligrams. Yeah. The concern, of course, is that it's it may have some impact on your body at that high dose because you don't typically make it that high of a dose, but it's
Yeah.
still a very powerful
But it's
molecule.
still an antioxidant.
Yeah,
So
yeah.
I think it depends on the person. Like some people that are more sensitive to melatonin, I think a good test is like, are you sensitive to it? Like, how do you feel? Like, I think a lot of people just don't listen to their body enough and they kind of underestimate that, that subtle, like check in with their body. How are they feeling on something? But if people are sensitive to melatonin, they might need zinc, they might need magnesium, they might need B6, they might need folate. So melatonin actually has a really interesting interplay with methylation because melatonin and folate work together. So if someone's not methylating well, they might not be able to use melatonin well. So that's why some people, it's better for them to start with topical, if they're sensitive to it. Things like tart cherry juice, like are ways to naturally improve it. And then some herbs like scutellaria, moringa, chamomile, St. John's wort. These are things that can help naturally boost it.
So, are you familiar with the concept reductive stress?
Reductive stress.
Yeah, when you have a lot of, if you have a lot of antioxidants, it's a problem you can get into, and you can actually suppress energy production in the mitochondria if you have reductive stress. It's the oxidant. That's the opposite, exact opposite of oxidative stress.
Oh, okay.
So that's somewhat of the concern of too many antioxidants that can be problematic.
Yeah.
So it's a fine balance. But and this is all an academic intellectual exercise, which is why clinicians who have integrated energy testing models are at an advantage because you're just not guessing. You're not trying to figure it out from the last study you read. You have a feedback from the body that helps you guide and customize the treatment for the person.
Yeah, exactly. I always find the testing so fascinating. Like I recently had someone that's blood sugar was like, I think their A1C was like a 5.9 or something. And the first like remedy that resonates with them is like a blood sugar remedy. So it also does kind of like prioritize like what is most out of balance and what would be most beneficial to the body at this time. So when I see something resonate with someone kind of like higher up on their list, it basically means like this is something that's like more of a high priority for them at this time. And then as you remedy things, we uncover new things. So it's kind of like peeling back layers of an onion as we go.
This is great. So how long have you been practicing?
I started probably maybe 8 months ago or so.
So this year.
Well, that's when I started my business.
Okay, yeah.
Like about 8 months ago. But yeah, it's been like super fascinating, especially just like making subtle connections, seeing things like pop up time and time again. Like vitamin C is like always popping up for people on their eye scans. Just like making those connections has been super interesting for me. And just seeing like there's a lot of, anyone that's having problems with their nervous system, those are the people that I'm seeing are manifesting with eye problems. So it really all does come back to nervous system regulation, vagus nerve regulation, especially with people. A lot of people nowadays are struggling with dry eye. And a big problem for them is just vagus nerve regulation, regulating their nervous system. Because when that's working, the body can't heal if it's in, a stress state and it's in a sympathetic state. So yeah, that's been super interesting to see. And then I've recently
wait, before you go on,
yeah.
I remember listening. I said I wanted to ask about this, but then I realized I learned it from you. One of your previous podcasts that a really common cause of dry eye is the radial keratotomies, the laser eye surgery for the cornea for vision correction. Is that a real? Maybe you can expand on that for a moment.
Yeah.
Is a factor for dry eyes.
LASIK actually, when they do LASIK, they are cutting through some of the corneal nerves. And so when you do that, obviously, if the cornea has less sensation, it's going to affect blinking. It's also going to affect how the eye is able to drain. So the corneal nerves actually function in the eye as like pre-lymphatics. So it's going to really affect how your eyes detox as well when you get that surgery. So a lot of people don't realize how kind of like detrimental that surgery is, because it's kind of marketed as like a quick fix, like,
Mhm.
you won't have to wear glasses, you won't have to wear contacts anymore. But a lot of times when we take those routes, and we kind of mess with nature, we end up messing with our body's innate intelligence. And then the other interesting part I've recently been learning about LASIK is that it locks people in a certain body posture, because you're kind of like tattooing a prescription onto the eye. So
Mhm.
when you do that, it impacts the body posture, because your body will only go where the eyes are comfortable leading. So basically, let's say they tattoo the wrong prescription onto your eye, that's going to force you to use one side of your body more than the other and neglect
Mhm.
one side of your body. And so having that prescription kind of like tattooed onto your eye is going to affect how your brain senses the ground. And when we affect how your brain senses the ground, we affect the body's ability to relax. Because when the body is like searching for stability and searching for the ground, you're in a fearful state and the body can't relax. So that's why some people even have chronic pain, and they could literally get out of chronic pain by fixing the glasses prescription, because that's going to help their body relax.
But you can't fix it if it's tattooed into your cornea.
Yeah, exactly. It's a lot harder to fix. So I do like kind of collaborate with someone who does postural restoration.
Mhm.
It's called PRI.
Mhm.
And she says that LASIK patients are her hardest patients, because
Mhm.
they're so patterned, like their bodies are so patterned because of that glasses prescription that they could never take off.
Mhm.
It's not
So
like once you get LASIK, you can change the prescription. You can't. It's
no,
like
no, no.
they calculate that prescription and then they tattoo it onto your eye.
So your recommendation from a really high level, naturally oriented eye healthcare professional is to avoid this. It is not your
Avoid it.
best bet. There's other
Not your best bet.
strategies.
Yeah.
Yeah, so never get that. If you have it, that's a whole other discussion. We'll probably spend a whole other hour talking about that, but and I don't want to go there now. But what would you reckon? So how large of a population are you seeing, or percentage wise of your the people you're seeing are coming to you specifically to improve their vision from the as an alternative to using eyeglasses or contacts, correctly?
Yeah, so there is actually such a big demand, I think, for this like natural vision improvement.
Mm-hmm. Mm-hmm.
And I think it's because of all the near devices, there's such a huge increase in the myopia epidemic. I think like 50% of people are projected to be myopic, when it was like it used to be 20% back in the 70s.
Mm-hmm.
Um, so yeah, I think natural vision improvement, there's a big nervous system aspect of it, and there should be a big nervous system focus. Because what happens when we're looking at screens all day is that the ciliary muscle contracts, it has to contract, and it kind of gets locked in that contracted state. And then when you go to look far away again, it's not able to fully relax anymore, because
Mm-hmm.
it's so used. The eyes are like pattern addicts. So the eyes like to just like stick to what they've been doing. Like they don't like if you're not like using them, looking near, looking far. So like looking near to far is actually one of the ways to quickly regulate the nervous system. It stimulates the vagus nerve. So it's actually a good trick if you're stressed or if you're caught in fight or flight. You can take two fingers or you can take two pencils, and you can hold one in front of your nose, and then you can hold one maybe like 40 feet away from you, just like arm's length. And if you look from your near finger to your far finger consecutively, that's actually a way to stimulate the vagus nerve and calm the body down.
Mm-hmm.
So I recommend that to people. Just like looking far away is another way to relax the nervous system. Opening up your peripheral vision. So when people are caught in fight or flight, they tend to only focus on the central vision and they forget about the periphery. So one of the ways that you can kind of stimulate your peripheral vision is just by walking around and looking far away. You can also practice a technique I like called open focus, where you're kind of looking at the world more softly. And instead of focusing solely on your central vision, you're inviting the periphery in and you're kind of just letting your eyes wander, letting your eyes notice what's around them. Healthy eyes like to move a lot and they don't like to just like stay in one place and stare. So that's another bad habit people have, is that they stare and they keep their eyes like in one place. And then that's also what glasses kind of train the eyes to do. Glasses have an optical center. So there's one part in the glasses where you see most clearly. So glasses in a way are kind of like visual confinement because they lock your eyes into one place.
Interesting. So it's probably an entire podcast to go over some of the strategies, but maybe you can highlight some of the more effective interventions that you found to help people restore their visual sight naturally.
So
without purchase lenses.
Even just like walking in nature, walking stimulates what's called lateral eye movements, and lateral eye movements tell the brain that it's okay to relax. So just walking, looking far away. If you're working on a computer, every 20 minutes or so, try to get up, walk around, look far away. I would say every 20 minutes is probably like the cutoff. I would say like don't sit down and stare at your computer for longer than 20 minutes. And then certain eye exercises, I definitely think there's benefits to that. Your eye movements actually correlate with something called the oculocardiac reflex. So moving the eyes actually, like laterally specifically, can help calm the nervous system down. You can close your eyes and kind of picture a coin and then trace the outsides of the coin with your eyes. So just like get the eyes moving again, get them looking far away. You can even practice something called palming, which is a nice way to kind of calm the eyes. If you have like an eye twitch or you have eye strain, you can sit down for about 20 minutes and then just like gently cup your hands over the eyes. That's a really nice way to just calm someone down. I've also noticed that people's vision changes depending on how stressed they are. So if you're going to the eye doctor and you're in a stress state or your posture is locked up in a certain way, that's going to affect the prescription that you get. So what I've been learning is that doing a refraction, if you go to the eye doctor and you get a refraction done standing, that's much better for body freedom. And so that's one thing people could try, is that if they go to the eye doctor.
And that isn't standard, is it? Most of the corrective assessments are done in the seat.
They're done seated.
Because the machine is designed to do that.
But the way you can do a standing refraction is with a trial lens frame. So most eye doctors have a trial lens frame. The problem with this is it would take too long. Because obviously you only have like not very long, because nowadays people want to get more and more patients in because obviously the insurance isn't reimbursing as much as it used to.
Can you do a hybrid model where you can do the initial screening on the sitting and then say, okay, give me this, and I want to do the final assessment with the standing, the trial lens?
Possibly. I mean, I know they're doing it at like one of the optometry schools that works with the physical therapist and the body posture specialist. These are people who really, really need the right prescription because they're in chronic pain. They've had, surgeries, even something like any type of surgery or any type of injury that's kind of making the body posture locked up. They really need to get the right prescription. So it's really cool to see. I think this is definitely up and coming in the field. Hopefully, like we'll start to see more people integrating this. But specifically, the PRI practitioners work with neuro-optometrists and neuro-ophthalmologists. And they work with people that are having, post-concussion syndrome. Even trauma can cause kind of like the visual system to go wanky. I've seen people damaged by things like Lexapro, and depression medication can also really mess up the visual system. Interestingly enough, I
And
think,
if we could stop there for a moment, it's largely because most of the antidepressants in the 21st century are SSRIs, and they actually increase serotonin levels, which
serotonin.
is the precisely opposite of what you want to do to treat depression. You want to
Exactly.
lower serotonin.
Yeah. So interestingly enough, I've seen people, get super damaged by these medications, and it really impacted their visual system, where like they would go to read and their whole body would just lock up and they would have like a panic attack. And that is partially due to like way too much serotonin in their system. Um, so yeah, that's super interesting correlation there, because we were talking about serotonin before, but um, yeah, it's just been so fascinating learning about all the posture correlations with vision. So kind of been going down the rabbit hole of that lately. um, but the other thing that's interesting is that the speed at which your eyes can make movements. So your eyes are always in motion. They're making these tiny little saccadic eye movements. Um, and so basically, what's super interesting is that the speed of at which your eyes can make these tiny movements actually correlates with neurodegeneration in the brain.
Really? Is
Mm-hmm.
that something you can measure with an instrument?
I think they do have instruments that measure it now.
Okay.
Um, but yeah, I can't think of the specific one
It
off the
would
top
seem
of
like
my
it'd be
head.
a good screen for
Yeah, for
Alzheimer's.
sure.
Yeah.
Yeah, that would be cool. Um, and then there's another exercise you can actually do to kind of help with that movement. It's basically like you stand up and you're twisting your body from side to side. It's called the long swing.
Oh,
And that's basically a way that you can kind of improve your peripheral vision, improve the saccadic eye movements. Another way you can practice it is literally just by holding up two fingers and switching back and forth from one finger to the other really quickly.
I mean, switching, looking at one finger to the
Yeah,
other?
so look at one finger, look at the other, and just switch back and forth.
Okay.
Um, so yeah, it's interesting how much the eyes can really tell us about the brain in particular, because it does originate from brain tissue. So when we think of the eyes, they're really just an extension of our brain. And so that's why I really think there's so much potential there for like early treatment, early diagnosis of anything that's going on with the brain and the nervous system as well.
Well, I applaud you for your efforts at seeking to apply natural interventions and working with the body to do that. And it's so wonderful to see someone at your stage of your career being able to focus on that from the beginning.
Yeah. Yeah,
Well, that is just amazing.
exactly.
So I'm curious, what motivated you to go into optometry?
Yeah. So looking back, I always wanted to be in the medical field. I first became really interested in the eye specifically, just visit because I had glasses as a kid.
Oh, okay.
Not a super high prescription, but I was always just like fascinated when I went to the eye doctor. And I was like, wow, this is so cool that like she can actually see into the blood. Like she explained to me that she could see into the blood vessels, and like she explained that you can diagnose like high blood pressure. Diabetes is one of the other things that we really see with the eyes as well. We'll see like blood leaking out into the eye and things like that. That's basically showing the blood vessels are getting weak and leaky because of the blood sugar imbalances. And I just found it super interesting how much the eye is connected to the rest of the body. And the other thing I really was interested in from early on when I first was considering optometry was vision therapy,
Mhm.
because I did shadow like a vision therapist, and you could literally see like he was basically fixing ADHD. Like these kids were diagnosed with ADHD, but it was really just a vision problem. So I got to see that early on, and it really fascinated me. And then I got to see how convergence insufficiency, a lot of kids struggle with that, and that really like holds them back in school. And so I got to see how you could use like prism glasses in kids that have convergence insufficiency, and that can totally change like their confidence, their posture. So they would use the prism glasses before doing the vision therapy. And that was just a way to kind of help them in the meantime before they fix how their eyes work together.
That's terrific. So I suspect that optometry school is somewhat similar to medical school with respect to the percentage of the students there who have adopted and integrated this natural approach to healing into the field. So what would you say? I would imagine you were probably the anomaly in your class.
Yeah.
Was there anyone else like you?
Not that I really knew of. I definitely have seen like a couple of other optometrists that are kind of more being more natural minded. I think your best bet at finding a more natural minded optometrist would be to go to maybe a neuro optometrist or like a optometrist that specializes in vision therapy, because when you go to someone that specializes in vision therapy, they're actually looking at how the eyes work together and not just like, do you have 20/20 vision?
And how do you find a neurooptometrist?
You can Google it.
No, you don't want to use Google. Just use the search engine, not Google.
Yeah, you can use the search engine. I don't know if there's, just look it up, I guess, on the internet. And then to find a vision therapist, you can go to the website COVD, and they have
COVD.com.
COVD.
COVD. Okay, this is like COVID without an eye.
COVD vision. Okay, yeah. So covd.org.
.org. Okay.
And they have a place where you can like search to find a doctor. And that stands for the College of Optometrists and Vision Development.
Okay, perfect.
Or you can just, find someone that specializes in PRI, and they usually work with like specific optometrists that are more open-minded to working with the whole body instead of just slapping a prescription on the eyes and saying, okay, here's your prescription that's set for 20 feet away, wear it all the time, which is definitely going to make your vision worse because you're wearing a prescription that's 20 times too strong for most of the day. Because if you're doing mirror work and you're using a prescription that's set for 20/20, that glasses prescription is 20 times too strong for you.
Wow.
So what I tell people is I say, if you can't, find like a PRI practitioner or someone that specializes in
what's
working.
PRI short for? Postural something?
It stands for Postural Restoration Institute.
Okay.
And so if you can't find that, you can pretty much just, ideally you would be using, let's say you're working on your computer. Ideally, you would be using a prescription that's set for that distance, right? So I would say if you're spending most of the day on the computer and you can go without the glasses, obviously do that. But if your prescription is too high and you can't see at anything at near, just get a prescription that's set for that distance if you're spending, most of the time doing that.
Okay. Yeah. Can customize it for your specific needs.
Yeah. So that's what you really want glasses to be, because that's what your eye does. Your eye customizes what you need for different distances.
So it may be better, to have multiple prescriptions. So what are your thoughts on, I'm not sure that the jargon, the lens. Yeah. Bifocals, trifocals or progressive lenses. Versus having actually two separate glasses.
Yeah. So I definitely prefer two separate pairs of glasses.
Okay.
The problem with bifocals and progressives is that they lock your eyes. Like they basically, you can only see from a very specific part of the glasses. So that locks your eyes into that one position. So that's locking up your posture, and that's also locking up the nervous system, because eye movements obviously correlate with emotions. So actually, when we think and when we access emotions, our eyes make certain movements. So like, let's say you ask someone like, oh, what's your birthday? You'll notice their eyes might go in a certain direction when they're thinking. And that's actually how we access information. We use certain eye movements because the eyes are pattern addicts and so are the brain. So when those two have to work together, the eyes are always working with the brain, basically, because they're part of it. So that's why when you lock the eyes into any certain position, you're not able to access, your brain isn't as fluid, your thinking isn't as fluid, your body isn't as fluid. So that's the big downside to wearing things like bifocals and progressives, is that they do lock your eyes into a certain position to see clearly.
So This is an interesting question because, as we alluded to earlier, the most common number one surgery in the United States is cataract surgery. Mm-hmm. So, where they remove the lens of the eye and replace it with an artificial lens. So, but that artificial lens is essentially a prescription, isn't it? And so, how do you address that? Because in light of what you just shared about not being locked into a specific prescription.
Yeah, there's definitely issues with cataract surgery. Some of them are that, like, once you get obviously it's a fake lens in your eye. So once you get that fake lens put into the eye, so basically with cataract surgery, for those people that don't know, they kind of emulsify your current lens, like they break it up into little pieces, they suck it out, and then they put a new lens into the eye. And then the problem is that the new lens, it does block UV light. So ideally,
there's some that you can get without it, though.
There are? Oh, I didn't know that.
I'm pretty sure. Yeah. It's at the special order. Yeah.
Oh, okay. I actually didn't know that. That's cool. So apparently you can special order one that doesn't block UV light. But the other problem with it is that the eye naturally has a way to kind of block blue light. So if you get cataract surgery, you really need to be wearing blue light blockers, because the natural lens has some innate protection against blue light.
Interesting.
But then the cataract surgery lens doesn't.
Is this blue light blockers in the daytime too?
If you're under a lot of artificial light, I would say yes. But
how about natural light? Would it be balanced by the red?
Yeah, natural light, you're fine.
Okay, that's right.
But especially at night, that's when like it causes the most damage. But I would say if you're under a lot of artificial light, you could wear like the lightly tinted blue light blockers during the day, and then the heavily tinted ones at night. So like red or orange lenses.
So do you have any recommendations to or guidelines on how to pick the right correction for a lens, a cataract lens?
It's tough. I would say don't go with any of like the multifocal lenses, because those have the same downsides to progressives and bifocals, and they try to kind of sell those to you as like premium.
They're a lot
lenses.
More expensive. Yeah,
they're more expensive. Yeah.
Oh, they're better for you if you can afford it. It's much better, but most people can't.
Yeah.
Because I think Medicare doesn't pay for that. That's an upgrade, right?
Mm-hmm. Yeah. So those are like big money makers, I guess, the premium lenses. But I would say don't go for those. And then I would say probably just go for like the basic lens. Don't do monovision. Sometimes they do monovision.
What's monovision? What is that?
Monovision is when you have one eye set for distance and one eye set for near.
Oh, wow.
That's really confusing for the brain.
That's a prescription for disaster.
Yeah. Yeah, exactly. So they can do that with cataract surgery too.
Yeah.
So don't get that. Just get like the basic lens. And obviously, I think there comes a time when people need cataract surgery, but I think you can prevent it. So I would just make sure you're aware of, including antioxidants in your diet. I find like since glutathione is one of the main antioxidants in the eye, you can even do like intranasal glutathione. So the best way to get to the eyes is intranasal route.
Interesting.
So intranasal glutathione is something that can be really beneficial for people that are suffering from cataracts. As we age, we know glutathione tends to decline. And then another thing I really like is taurine. That has actually been shown to delay the onset of diabetic cataracts. And then also TUDCA, which is a bile acid. That one has also been shown to help with tons of eye conditions.
Really? Why would a bile acid help with eye conditions?
So that really helps with your liver and processing cholesterol. So yeah, that one, TUDCA specifically, super, super helpful for macular degeneration.
Is it a brand name? I've never heard of that before. It's a brand name of bile acids, or?
So there's a prescription that's called UDCA. And then there's UDCA.
Okay.
UDCA. That one comes as prescription, and that's actually prescribed to people that have liver problems. So there's that one, and then there's another one which isn't prescription, and that one is called TUDCA. And
TUDCA.
TUDCA, exactly, yeah. And so that one is I think it's better than the prescription one, actually. But it's similar. It's a bile acid. So basically, like, you're improving your cholesterol metabolism. And when you move bile, you move toxins out.
Interesting.
So that's why things like castor oil packs are really helpful, because that helps to move like sluggish bile. And when your bile is sluggish, your body is like retoxifying itself, basically. So when you take things like bile acids, that helps to move bile and that helps to move toxins out. So that also helps your liver, and that also helps your gallbladder as well. So those two things are super connected to eye health.
Do you ever use castor oil packs?
Yeah, I love castor oil packs.
Would that work considered here in conjunction with TUDCA bile acid?
Yeah, for sure. So basically, because castor oil packs also work because they help to move bile, and bile is how we excrete cholesterol, eliminate waste. It also converts cholesterol. So bile acids convert cholesterol from the body every day. And this is called kind of like hepatic synthesis. So then, like, the liver produces the bile and then it's stored in the gallbladder. And when you take the bile acids, it kind of helps to like regenerate and make new bile. And when you make new bile, you in turn detoxify.
Yeah. I just started using castor oil, but I don't use the pack because when I looked at it and thought about it, it didn't make any sense where you pour it on this piece of cloth and wrap it around your liver. You just put it right on your skin directly. And, as long as you don't not wearing a shirt or something, especially before you go into the sauna, you can integrate a near infrared sauna where you can integrate the light therapy with the castor oil. It seems like a much more efficient and application of the castor oil.
I found them to be pretty effective. Like, I know some people can even have like detox reactions from the castor oil packs because you're moving bile. And anytime you move bile, you're getting rid of toxins. So some people, like, when they first start out doing them, they don't realize how powerful they are. And they'll actually experience like nausea, which is a sign of like moving bile. And they also might get a headache, or that's like kind of like a detoxy reaction from it. So that's a big sign that, your liver and your gallbladder drainage pathways are stuck.
Yeah, it was Edgar Casey was one of his favorite recommendations was castor oil packs.
Yeah, those are pretty good. You can also do them over the eyes too.
Really?
Yeah. They have like castor oil packs that just
what would the benefit what would the benefit there be? What's the mechanism?
I've heard from specifically from people that they just help with like detoxification. You can do them over the thyroid as well. People with dry eyes have experienced relief from them. So yeah, I've personally just heard helps with dry eyes. Even if you have, some people get like fibrosis on their eye, it's called like pinguecula. That's another sign, if people have that they could really benefit from something like TUDCA or castor oil packs, because that's a sign that the liver and the gallbladder need support.
I wasn't aware that pinguecula was related to fibrosis, but my recent understanding of fibrosis is that a big central role in that is high serotonin levels.
Yeah, I think fibrosis, it can also be due to excess calcium.
Yeah.
So that's why vitamin K, and then systemic K2.
K2, yeah.
And systemic enzymes as well. So like serrapeptidase, nattokinase, that can help break down.
Do you know what the strongest fibrinolytic enzyme is?
Is it serrapeptidase?
Nope.
Nattokinase?
It's 30. No, this is 300 times stronger than nattokinase. 300 times.
300 times.
Lumbrokinase.
Ah, interesting.
Yeah, it's cool. Like 30 times higher than serrapeptidase. So yeah, that's the one to use. But you don't want to use it. If some people use them regularly as an alternative to taking anticoagulant therapy for legitimate conditions. But if you use the same one every day, you can develop a sensitivity to it. So you want to alternate them. But for short term, high dose fibrinolytic therapy is like amazing. I remember that earlier this year I was doing a training and I had workout bench. It was terrible. And I just got this huge hematoma in my inner thigh, and it was just massive, but indurated. But I took like 30 of these lumbar kinetics a day, maybe not 30, maybe 20. Because in high dose on an empty stomach, they're so effective, but it just abolished it in a few days. It was crazy.
That's awesome. That's super cool.
Well, Taylor, you are an amazing woman, amazing
Thank you.
I just
That means a
love
lot.
well, I know a gem when I see one. So you're just killing it. I just love your passion, the deep knowledge you have, and how you applied it, and the way your brain works. And it's just, you're an anomaly. We don't find clinicians like you too frequently. So I just congratulate you for what you've done so far in your
Thank
early
you so much.
career.
Yeah.
So
Thanks.
people feel likewise, and I bet there's a high percentage of people watching this who struggle with some visual issues. How would they connect with you? Or
Sure.
yeah,
So you can schedule, I do like free discovery calls. If people want to just see my approach, tell me a little bit about what's going on with their eyes. So yeah, you can find me. I usually connect with people on Instagram. My Instagram is optimizing health. It's OPTIMEYEZING, optimizing. It's kind of like a play on words with the I. So yeah, you can find me on Instagram. That's usually the main place I connect with people. So yeah.
All right. Well, it's really great to connect with you in this format, and I am sure you're going to be really, really busy and providing a lot of value to so many people. So thanks for what you're doing.
Yeah, of course. And thanks so much again for having me. It's such a pleasure.
Thanks so much for watching. Remember, hit the like and subscribe button so you can get more videos that can help you and your family take control of your health.